suicide rates in rural and remote areas are higher than in metropolitan areas because of access, because of shame, because of people's ability to recognise themselves what's going on and be able to seek help. I'm the boss of our team of rural generalist doctors. So we are experts in the full range of primary care, and we also have emergency medicine skills. We're like the Swiss Army knife of general practitioners. People living in rural and remote Australia have a whole bunch of challenges when it comes to their mental health. There's financial difficulties, environmental difficulties. A lot of people remotely also have a higher rate of physical health problems, which then impacts on their mental health. I think actually the biggest impact in our remote communities is due to intergenerational trauma. Also, people in those communities are often living with the most severe degree of poverty in the state. Some people themselves are ashamed to be thinking that they might have a mental health problem, and sometimes people are afraid of getting help either from their family or friends or from a health service. So when we come in and see people at a clinic, no one really knows who they're seeing and whether that person is a mental health person. It's very different from rocking up to the mental health service in town. As part of our activities, we like to support some of the remote community events that are held in the outback. So that's an opportunity for people to come alongside us, not for an appointment, but just for a yarn. Our mental health team also run suicide prevention and mental health promotion activities in remote communities. We offer 24/7 help, so if someone rings in the middle of the night and they're feeling suicidal, they'll get put through to our duty doctor. I had a patient who'd had a recent major health event, and whilst his recovery from that was going well, he didn't seem himself. We were able to identify that actually his health event had really impacted his mental health, and that enabled us to start a conversation, start some therapy, and when we were able to see him a few weeks later, he was well on the way back to recovery. In terms of all the creativity about really providing a service that's meaningful, we need all the funding and help we get. We really appreciate HCF because it enables us to do the work that we do. Like us, they're wanting to be there for people in their day-to-day and when they need to go to hospital.